It's really important to underline the trauma that people go through in the way you approach treatment. Because when you treat somebody with straight-on depression, it's a lot easier than treating someone with depression and post-traumatic stress disorder. And I always say that, they ought to change the name from post-traumatic stress disorder to post-traumatic injury. Because what happens is it's a real injury to the brain. And medications alone do not help people with post-traumatic stress. What medications can do in adjunct with therapy is really get the person from one place to another in a rational, reasonable way where they can get past their trauma, but still be able to deal with some of the stuff that they've been dealing with. A lot of times when people are traumatized, a whole cascade of stuff that goes on with your stress hormones increasing. They over time they'll decrease, and you'll start getting that stress fatigue, and then dealing with that part of it, and also dealing with how your neuroreceptors have taken a hit. A lot of times, your body starts downregulating serotonin, norepinephrine, and/or dopamine, and you start to get into that depressive state. So what happens is that you really do have to address the trauma. We've been doing this for years. I mean, I've been doing this since we started 10 years ago, but I've been in practice for almost 20. And I was here in a place called Coronado, where Coronado have dealt with a lot of vets that are coming back from the Persian Gulf War. And so I've worked at VA health centers before. So working in VA health centers, seeing the traumatized soldiers coming back, and then learning from the VA health systems on how to deal with trauma, not only pharmacologically, but also therapeutically, psychologically speaking. In my outpatient practice and also in my residential and partial hospitalization program, we are trained to identify as many things as we can so we know what to treat. So it's not as if someone's going to come to my office and we just talk about, go through the layers of depression, anxiety, where they're going through, but we also hit on the trauma and whether they're having traumatized nightmares and whether they have a startling reflex. When we get to that point, we can also identify things like people that are traumatized. A lot of people that have borderline personality have been traumatized. And so we need to deal with not only the personality type, but also with the trauma. And to do that, there are several different mechanisms that we use. There's prolonged exposure. There's EMDR. We use also in adjunct with trauma, with using the therapeutic approaches, we use stellate ganglion blocks. And a stellate ganglion blocks helps reset the nervous system, and it does a hard reset on it. So people can deal with that stress a lot easier. When you go into therapy and you have all that stress and all that baggage behind you, and you have a therapist that is trying to unpack this stuff with you, you've got to be able to deal with how we deal with trauma in a very legitimate way. People can deal with trauma in other ways. I mean, talk therapy is not the only way you can deal with trauma, because we also refer people out to movement therapy. We refer people out to equine therapy. Because just dealing with things in that way, and also with yoga, meditation, breathing exercises, you've got to be able to wrap around. One shoe does not fit all to deal with people with trauma. Everyone that comes to the door is like a new experience in that they have other things that they come into the table with. And now we've got to unpack it so we can help them and guide them through this. Stellate ganglion is a bundle of fibers that run on the sympathetic nervous system. So you're basically resetting all the adrenaline that you're giving off during your feelings of anxiety because of the trauma or because of the stress. When you give a stellate ganglion block, you change the therapeutic process because you allow them to go through therapy and get in there and work on things more diligently and more effectively. When you're having all that stuff and you're guarding yourself and you have a lot of resistance to wanting to talk about things, it helps open up those channels, and it helps people relax as they go through it. Like with prolonged exposure, with extinguishing behavior, you can help someone breathe better and exercise. And what they do is they visualize their trauma, and then we help them with their vitals and their system, the breathing, to help them relax through it. So it's almost like they can be flooded with something and not feel that stress anymore.